All right, good morning, everyone. Welcome. Thank you for making time today to come and join our webinar. My name is Jenny Fitzharding, and I'm a clinical counsellor and volunteer for NEA BPD Australia. And I'm delighted to be hosting this webinar today with Dr. Edward Selby. First up, I just want to acknowledge country. And that in the spirit of reconciliation, NEA BPD acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. And just for those of you that are not familiar with NEA BPD, the National Education Alliance for Borderline Personality Disorder in Australia is here to primarily support families and carers of people living with a personality disorder, which can affect up to 17% of the population. NEA is a volunteer-run organisation supported by over 200 volunteers right across Australia. And we're one of 26 countries around the world that offers the Family Connections program. Family Connections is a 12-week evidence-based program that provides skills and hope to family members and carers. The program is offered free of charge to participants and is led by our volunteer leaders who generously give their time to support other families. Unbelievably to me, we receive no government funding at all, and we're completely reliant on the generosity of families and other supporters. So thanks to everyone who was able to make a donation today. Now, today's webinar, today's format will be, we'll hear from Dr. Selby, and any questions that you have, just put them in the chat and I will ask them at the end of the presentation. So today we're going to be hearing about the emotional cascade model of borderline personality disorder and technology that can help to treat that, so apps and so on. As I'm sure many of the people listening today know, intense emotional experiences can quickly spiral into rumination, extreme distress and maladaptive coping strategies such as self-harm or impulsivity. So we're going to have a look at how mobile health apps, digital monitoring tools and AI-driven interventions can be applied to interrupt these emotional cascades in real time. And a little bit about Dr. Selby. Gosh, there's a lot to say about Dr. Edward Selby because he's done a lot. He is a full professor and the director of clinical training in psychology development at Rutgers University in New Jersey, where he also directs the emotion and psychopathology lab. Dr. Selby's work looks at how emotional dysregulation, so emotional lack of control, impacts on mental health challenges, especially suicidality and self-harm, borderline personality disorder and eating disorders. And he's best known for his work establishing the emotional cascade model of BPD and self-injury, and more recently, the positive emotion amplification model for anorexia or of anorexia nervosa. I'm looking forward to hearing more about an app that he's been involved in called Stormbreaker, which was designed directly from his research on emotional cascades and BPD. He's published more than 135 peer-reviewed publications and book chapters, and has received extramural funding awards from the National Institute of Mental Health, the National Science Foundation, the Brain and Behaviour Research Foundation, and Janssen Pharmaceutica. He currently serves as editor-in-chief for the International Journal of Cognitive Behaviour Therapy, as section editor for Frontiers in Eating Behaviour, and he is on the editorial boards for Clinical Psychology Science, Suicide and Life-Threatening Behaviour, the Journal of Psychopathology and Clinical Science, which is formerly the Journal of Abnormal Psychology, and the Journal of Clinical Child and Adolescent Psychology. Okay, so over to you.
All right, well, thank you for that warm introduction, and I think you covered all the key bases here. Just want to reiterate, I've been studying borderline personality disorder for over 20 years now, and it's always been a passion of mine ever since I first learned about it when I was early in my training. And so I'm very passionate about helping people who have a BPD diagnosis, as well as helping families try to best help their loved one as well. Oops, let's see here. Okay. Here's just a picture of not my lab, but Rutgers, where my lab is located, the Emotion and Psychopathology Lab at Rutgers, where we study the conditions that were previously mentioned, including BPD, but also suicide and self-injurious behavior and eating disorders. I imagine that most people here today are already a little bit familiar with borderline personality disorder, BPD, but just in case you're not, I'm going to quickly run through the symptoms. And that includes intense emotional disturbance, interpersonal storminess, identity disturbance, and impulsive or dysregulated behaviors, including substance use, self-injury, binge eating, impulsive shopping or sexual behavior, and verbal and physical aggression, and other impulsive behaviors beyond these. One of the aspects that my lab does in trying to understand borderline personality disorder is looking at this from a framework of both emotion and trying to really look at the emotional core of the disorder, and then also looking at the experience of borderline personality disorder through a nonlinear dynamics and complex dynamic systems perspective. If you're not familiar with this approach, it's okay. I'm going to sort of walk through some elements of it. But you can just kind of understand that this is a little bit different than a lot of traditional work in psychology, which is much more focused on linear relationships and trying to understand if this variable increases, there's a clear and direct effect in this other variable that's linear. And in reality, many psychological disorders are very complex and they have a developmental course to them. Um, sorry, somebody's calling me there. Sorry about that. Uh, Many exhibit curvilinear relationships and bidirectional feedback. By curvilinear relationships, that's a little bit different than a linear relationship in that something can get more and more intense over time and have more and more drastic effects than just a simple linear relationship. Likewise, there are bidirectional effects where one variable can impact another, and then changes in that variable can impact another variable. And we'll see this come out in the emotional cascade model as we get into it. So we think of borderline personality disorder as a complex disorder, but keep in mind, complex does not mean overly complicated per se. Rather, complex means that we can kind of boil some common factors down, and that when those are running within the system, that can cause a lot of complex behaviors and outcomes. So the emotional cascade model was first published by myself and my colleagues back in 2008, and is really meant as a way of understanding the connection between certain intense emotional experiences and different behaviors, often that we call dysregulated behaviors, which we talked about already as sort of impulsive behaviors, self-injury, cutting, substance use. But we have also extended this as we think a very good explanatory model for a lot of BPD troubles that people have, and we'll kind of see that as we go through this. What is an emotional cascade? Well, it's a unfolding process that takes place over time that can go quickly over a matter of minutes to potentially lasting hours. And it usually starts with the experience of a negative emotion. For example, somebody said something kind of critical, or maybe you had a bad thought about yourself if you have this diagnosis, BPD. And then what happens is we think that people ruminate on these experiences. Rumination is common across many different psychological disorders, but we think that it's particularly important in the experience of borderline personality disorder. Rumination is referring to thinking repeatedly about an upsetting problem in a way that's kind of cyclic over and over and over. Why did this happen? Why did these bad things always seem to happen to me? What did I do wrong? Why am I bad? And what we find is that with emotion research, that when you ruminate about something, it tends to make you more upset. So if you start off a little bit upset and you start ruminating, you tend to make yourself a lot more upset. And then as you get more upset, people tend to turn to even more rumination. So we believe that there's this bidirectional feedback cycle where negative emotion increases rumination and vice versa. Well, we think that as this gets into the fullest stage where it's the most intense rumination, that a person can tolerate, that we call an emotional cascade. This is when dysregulated behaviors come in. Things like self-injury or binge eating are good examples I like to use. People often engage in these behaviors, we believe, in the middle of an emotional cascade because those behaviors have strong physical sensations. People who self-injure are often reporting cutting to feel the pain, or potentially the visual effects of seeing blood. Binge eating, you have the feelings of fullness or the taste of food. Substance, you have the physical effects of the substance. And we think that these sensations short circuit the emotional cascade by allowing someone to focus their attention away from their upsetting thoughts and emotions and onto the physical sensations of the behavior. And when you short circuit the emotional cascade, it goes away and you get emotional relief. Now, this is sort of both good and bad. Good in the sense that you got rid of this really intense, or at least you diminished this intense emotional experience. However, it's bad because you might have done so in a way that is not also going to help things. For example, self-injury or cutting. Now you've got an injury, or you're potentially causing problems with other people when they see that you're injured. Or using a substance can lead to other impulsive or problematic outcomes. So another way of kind of thinking about an emotional cascade is people are having this emotional experience that's very distressing, and then they ruminate, which is kind of like throwing gasoline on a fire and making it much, much worse. Well, dysregulated behaviors are kind of like, well, now the fire is really out of control, so then you use a huge fire hose on a small fire, and then that causes a huge problem in itself. So the behavior has a functional component, it's reducing the negative emotion, but it's also causing all this blowback and all these other problems. And ideally, what we're ultimately going to want to aim for with this understanding of emotional cascades is we want to use healthy coping behaviors to help dampen the negative emotion and stop the emotional cascade process without causing harmful secondary consequences. So, sort of like putting out a fire in a careful, controlled manner, so to speak. We have done a lot of research on the emotional cascade over the last 20 years or so, including several studies using correlational, longitudinal, and experimental methods, linking BPD experiences to dysregulated behaviors, but also linking emotional cascades. Sorry, I think I said something wrong there. Linking emotional cascades to dysregulated behaviors, but also linking the experience of emotional cascades to BPD. One of the things that we use a lot is what's called experience sampling, where we get out into people's lives through things like smartphones, and we get data on what's going on in their daily lives. And we found that using our emotional cascade approach, we can predict when BPD behaviors are going to occur, usually within about 2 to 3 hours. So we'll take data and look at that and say, oh, wow, there's a good chance of a behavior occurring in the next 2 to 3 hours when someone's feeling like this. We've also shown that emotional cascades are distinct from rumination itself. Although rumination is a part of an emotional cascade, it's not the full explanatory part. It's just a part of a bigger process. And we've actually shown that there's some big differences between rumination versus emotional cascades, including that emotional cascades operate in a much more of an exponential fashion rather than a linear fashion. Exponential means that it might start out kind of slow, but then it ramps up really fast once it gets going. And then it's a well integrated model, we believe, the emotional cascade model is. And we think that it really helps understand the experience of borderline personality disorder, as well as has a lot of treatment utility for both helping understanding when these problematic behaviors are going to occur, as well as how we can improve those behaviors with alternative methods. This is just one example of what the emotional cascade model has shown through some of our data, which we published back in 2013. In this study, we had people with varying symptoms of borderline personality disorder do a smartphone protocol where they collected data out in their daily lives, including experiences of rumination and intense negative emotion, as well as the various dysregulated behaviors we've talked about. And just to orient you, the line that you want to pay the most attention to is the dark solid black line on the top. That's the line for the people who had high borderline personality disorder symptoms. And in addition to having the high BPD symptoms, they also, when they had high negative emotion and high rumination, that was when the probability of a dysregulated behavior occurring in the next 2 to 3 hours was the highest. So if you look at the scale here, we're talking about 0 to 1. A 1 would be 100% probability. Well, we're finding that if you have those three factors in combination, we're finding about 90% probability that a dysregulated behavior would occur. So that's very helpful in understanding if we can understand when someone's emotional state at a certain point of time, we can understand if they're at risk for a dysregulated behavior. And this also applies to multiple behaviors. One thing we've tried to understand is sometimes when people do things like self-injure or use substances, they'll engage in multiple behaviors. And so this graph kind of shows the same thing, where people with the negative emotion and rumination, which is lag, means 2 to 3 hours before the behavior occurs, and they have high borderline personality disorder symptoms, they were more likely to report multiple behaviors, more than one. And we think that this is because sometimes the behavior kind of works in terms of getting that emotion reduced, but sometimes not enough. So there's reports from people who self-injure where they might cut and then they find it's not working, and then they cut even harder and deeper to try and elicit this effect that we believe is occurring. And so this kind of makes sense as to why you might see multiple behaviors occurring. This is sort of the bigger way we put emotional cascades into the experience of the full diagnosis of borderline personality disorder. We do believe there's a lot of other things going on in borderline personality disorder. It's not just emotional cascades. There are things like biology, complex trauma experiences, being in difficult environments or highly critical environments, having cognitive predispositions that might make things worse. But what we think is that all of those factors kind of center in and affect the heart of the model, which is the behavioral dysregulation that's a function of these emotional cascades. And we think that this is sort of the heart of what's connecting all these things in BPD. And what's interesting is if you use what's called a complex dynamic system model approach, this allows for sort of understanding how a number of little things can build up into a large thing. So think of ants in an ant colony. An ant colony can be quite complex and do really complex behavior, but it's made up of smaller parts. Well, we can think of the same thing with borderline personality disorder, where you have uh, one-offs, right? Somebody has an emotional cascade, they engage in dysregulated behavior. That in itself is not borderline personality disorder. But what happens is if you start to see repeated episodes of these emotional cascades and dysregulated behaviors being driven by a lot of these other factors, you start to see the emergence where we start to see what we call borderline personality disorder. It emerges from these underlying patterns of interaction and behavior. But what's interesting about in a complex dynamic system is that once the phenomenon emerges, in this case, borderline personality disorder, it starts to change the underlying components that created it. So it makes people even more dysregulated. They start to develop suicidal symptoms, for example, in some cases. Or another great example is they might start to decrease their distress tolerance. They might know that when they get upset, they have these emotional cascades, so rather than trying to sort of weather the storm of an emotional cascade, they just go straight to a dysregulated behavior right off the bat. So having the diagnosis, we think, then makes the factors that create it even worse, and that can make it explain part of why it can be such a challenging disorder for people. Well, how do we test a complex model? That's been an ongoing challenge. This is a model that has a lot of moving parts, but we also want to be able to test it as best we can. Most of our research has done piecewise testing of the model, looking at uh, structural models, looking at experiments and longitudinal correlations. But those can only sort of validate pieces of the model. So experimental tests, longitudinal investigations. We've tried larger structural equation models where you're putting a whole bunch of variables in, but these traditional models can't really integrate a lot of moving parts in time that well. So a lot of times these are very static. Even if they're large, they're static. And then they are often limited by the number of variables you can have, and they typically don't allow for bidirectional effects. And then what if you could take a bigger model, though, and sort of fit this in sort of a novel statistical way that would allow us to really capture the essence of this complex system? Well, this is something we did a few years ago where we applied what's called temporal Bayesian network modeling to understanding borderline personality disorder. And this is a family-based audience, so we're not expecting you to understand a lot about statistics. I'm not going to go into the nuances, but why I'm going to walk you through of why this is helpful for understanding the research on emotional cascades, but also I think really helps us show that this model has a lot of validity because we're finding this really novel way to test the complexity of the model. So using data from a EMA or experience sampling sample of self-injuring adolescents and young adults, many of whom also had high borderline personality disorder symptoms. We took data from the momentary level, which is daily observations. How are you feeling right now? Are you ruminating right now? Have you had any behavioral problems? And then we were able to use that across several days and look at the person level variables such as borderline personality disorder diagnosis. And then we built a model that we thought would really represent this complex model based on the data. And this is what it looks like. You might be a little bit, oh my God, what the hell is going on here? It's a little bit, it's unwieldy, but that's actually kind of the way complex dynamic systems work. So I'm going to walk you through it in a little bit piecewise so you can kind of understand what this model is doing. We were able to use this kind of this very busy model to test the emotional cascade model in three ways. Using all this data, we were able to examine the momentary data and if that can inform whether someone has a BPD diagnosis. And then we were able to examine the utility of using some momentary observations to predict subsequent observations. So how are you feeling now? How are you feeling at time 2, 3, 4? And then determine the effectiveness of the modeling a diagnosis and predicting the data. So does having a diagnosis improve our understanding of what's going on in the day-to-day momentary data? So three different levels here. Some statistics in terms of validation with k-fold cross-validation. And ultimately, the goal was to try and accurately categorize outcomes in terms of diagnosis, occurrence of dysregulated behaviors, and so on. So again, back to our ugly model. One thing that I want to emphasize here is that we sort of tried to layer it. So if you go to the left, that's time. This is all one day. So what we're looking at is one day, and we're looking at 5 observation points across one day. And then stacked on top of that is 14 days. So if we could really like expand this, there'd be 14 versions of this. So it's a lot of data being folded into this one analytic model. So again, if you're having a little trouble, we'll break it down into the pieces. So for example, this would be sort of in the first part of the day, looking at someone's morning, time one. And what we were able to do is say, okay, if someone's experiencing rumination early in the day, does that have an effect on their negative emotion that they're having in the day, and then subsequent behaviors that are reported? We're also able to look at this data across the day, each day for 14 days to say, if we didn't know someone's diagnosis, could we use this data to actually predict if they have a borderline personality disorder diagnosis based on the way we've structured the relationships between these variables? And the answer was, yeah, actually, this model was quite helpful for understanding if someone had a BPD diagnosis. So this would be really interesting. Like if you didn't know someone had a diagnosis, you could have them go through this protocol, use this model in the data, and then it would be able to tell you with about 96% accuracy whether somebody had borderline personality disorder present, and 90% accuracy if someone had or 90% accuracy if they had it present, 96% accuracy if it was absent. It was also helpful for understanding some diagnosis with major depression, MDD, and PTSD. But one thing to be aware of is a lot of our BPD patients also had those diagnoses. So it was a little bit challenging to tease those apart. But the ultimate takeaway was that this is a really interesting tool that could be used in assessment for trying to help us understand if somebody has borderline personality disorder versus some other related condition that might be emotional in nature. In the second part, we were able to take data across the time points. Remember, in each day, we had 5 time points that spanned across the day from the morning into the evening, and say if someone is feeling this way at time 1, 2, or 3, Will that help us understand and predict how they're feeling later on in the day, especially the next step where we think the most short-term effects are going to occur? And what we see here, kind of highlighted with the yellow, is that if we were able to understand someone's negative emotion at time 4, for example, then we were able to predict their rumination at time 4 and then again at time 5. Likewise, we were able to predict dysregulated behaviors. So, for example, if we knew someone's experience at time 4, especially if they had high rumination and high negative emotion, we were able to predict that they would likely have a dysregulated behavior. And if you look at the numbers, it was really effective in terms of predicting. We successfully classified most of the behaviors occurring at time 5 using time 4 data. So that means that, again, we're able to kind of see in real world day-to-day experiences what's happening and how's that affecting people's behavior in potentially ways that we can hopefully intervene with. The last part I'll talk about with the temporal Bayesian network modeling is that we can also look at understanding if somebody has a specific diagnosis, such as borderline personality disorder, does that better inform our understanding of their rumination and negative emotion patterns? Can we use the diagnostic level data to predict data across multiple days throughout the day? And the answer was yes, the BPD diagnosis was very important. When we included BPD in the model and used that to understand the underlying data, our prediction was quite good. It increased the predictive modeling ability of rumination, negative emotion, and dysregulated behaviors. So very useful. What's really interesting though is if we actually specified the model and took that BPD information out and said, we don't know if they have BPD or not, does that help our model? And the answer was is it decreased the model in a pretty noticeable way. So what this means is that the momentary data is important, but the diagnostic data is also very important. And this kind of is highlighting this emergent effect where underlying interactions can lead to potentially the diagnosis, but then the diagnosis also affects the underlying factors that potentially created it. So this is supporting our complex dynamic systems model explanation of BPD. So what's the utility of this? We could use temporal Bayesian network modeling to enhance diagnostic assessment and have it so that you might even, eventually someday we might be able to have an app and have the app be something like along the lines of, do you have borderline personality disorder? Use this app and it will be able to hopefully tell you. Ideally, also in context of working with a clinician who help you people understand what BPD is. But that's really useful given right now to do a diagnostic assessment can take quite a bit of time. It requires a lot of like guesswork in terms of trying to ask people what their daily experiences are like when you're sitting in a room with them for an hour or two a week. The TBN model can also potentially help us differentiate diagnoses that are kind of similar to borderline personality disorder, but also a little bit different and might require a different type of treatment, like major depression or potentially post-traumatic stress disorder. We can potentially use this to improve treatments. We can help patients better understand their cognitive emotional patterns by having them go through these daily protocols where they can understand how their emotions and thoughts are connected to each other and how that can influence their behavior. And then we may be able to make a smartphone app that alerts participants when their emotions are high or they're at high risk for dysregulated behavior. More on this in just a minute. And then ideally, if we had a way to capture when people are at risk for these behaviors that are making their lives worse, be able to send a trigger for their trigger to help them understand, hey, this is a time to implement skills or to do something to hopefully prevent engaging in a behavior that you know is going to make life harder for yourself. So, what does the broader emotional cascade model mean for BPD treatment? Well, BPD is notorious for having no real effective medications. There's always things that are making progress, and medication can be helpful, especially when treating co-occurring conditions like depression. But there's no like go-to medication, at least that I'm aware of, for borderline personality disorder. It's not uncommon, at least in my experience, to see patients come in where they've been throwing lots of medications to try and address borderline personality disorder. But because the symptoms of BPD are not particularly responsive to medication alone, they end up with a med cocktail where it's a whole bunch of stuff because people are just trying to sort of throw medication on, see what sticks and see what helps. So that was often something that I would see that would be sort of a sign like, this could be a BPD case just based on what I'm seeing in the medication. And then only psychotherapy has really been shown to be effective, including dialectical behavior therapy, emotion regulation group therapy, mentalization focused therapy. And these are all great. If someone has access to the treatments and a provider they can go to, absolutely 100% would recommend someone get these treatments. Whoops, I missed a part there. But what's a problem with those treatments is that they're very intensive and they can be very long. And even more importantly, they're often not accessible. So they can, you might say, I need DBT, and then you look up in your local area if DBT is available, and there's no one doing it. So that leaves you with trying to get a self-help guide, trying to find webinars. So we thought this is a really great place for the emotional cascade model to help improve treatment for BPD. And to do that, we're going to sort of shift our sort of way of thinking about it a little bit because emotional cascades are an unfolding process. They're a little bit complex sometimes for patients to understand. So instead, we're going to shift to a storm metaphor. And so, what do you do if you see a really big storm coming in? Do you kind of just stand out there and wait until it's full blast and lightning is hitting all around you? No, you go and take cover right away. So, with BPD, we kind of think of it the same way. These emotional cascades are essentially big emotional storms, and if we can find a way to help someone cope with them earlier, that will hopefully help reduce the impact of those storms and potentially avoid really upsetting situations and problematic behaviors. Sort of talked about that, so I'm just going to skip through it. So this is where we developed the Stormbreaker smartphone app, which is a new app that we actually have out on the Apple Store and the Android Store here in the United States. It's not available abroad yet, but that is something that we're turning our attention to likely next year because it would be a good one to target for English-speaking countries such as Australia, but also UK, New Zealand, Canada. And this is a smartphone program that was designed specifically for borderline personality disorder. And through work from a generous philanthropic donation that was provided to the Rutgers Foundation, we were able to use these funds to really build a really finely tuned app that's up on the App Store and people are using as we speak to hopefully improve with borderline personality disorder. And we actually had a chance to test it and show that that's not just a hypothetical at this point. But in addition to BPD, we also think it's useful transdiagnostically. We think that because emotional cascades are transdiagnostic, although we think BPD is where there's some of the worst experiences, it still could have use for substance use disorders and eating disorders, for example. And so we've switched to the storm metaphor just for simplification. And it's designed to be a standalone treatment that's highly accessible. What we mean by this is that the app is designed for someone to download it and to just start using it. We've even built sort of a walkthrough that helps people sort of get oriented in the app. We have explanations for why we're doing the things we're doing within the app. But you don't need to go read a manual to use it. You don't necessarily need anyone specifically there to walk you through it. The app is meant to be sort of a standalone thing that if you didn't have access to treatment, you could use the app and we would hopefully see some of your BPD experiences improve. That being said, it can still be used in conjunction with therapy as well, but we haven't had a chance to explore that specific aspect of it yet. You can download it for free right now from the Apple or Android stores in the US at least. And then we have an English version and a Spanish version. And it has minimal therapeutic jargon. We don't call it rumination because most people don't know what that is. So we call it thinking or problematic thought patterns, and we'll see that. And then we think there's going to be measurable effects using the app alone, but also in conjunction with other treatments. Just as a quick note, the app was designed for us by Michigan Software Labs, who's our partner when working on this project. And they've done a fantastic job with building the app, which you'll see some screenshots in a minute. So, why do we think that this app will work? Well, what it does is it basically sets up a tracking regimen for someone to follow throughout their daily experience. And what we found was that this is kind of based off some of our experience sampling research, where we would give patients the smartphone protocol to go out in their lives and track rumination and negative emotion behaviors. And several times we had people come back and say, "This was so helpful. I learned so much about myself." And this like really, I just understand myself so much better. And we were like, "Oh, that's nice." Because we were just trying to understand what was going on. We weren't really trying to create an intervention. And that there's a lot of evidence of what's called therapeutic reactivity, the very act of paying attention to yourself and understanding how you're thinking and how you're feeling as it's happening is actually very therapeutic. And it's a little bit more effective in some ways than what we do in the therapy room, where we're asking someone, "Oh, what happened? Okay, something happened a few days ago. What were you thinking? What were you feeling?" But you're talking about days later when it's kind of fuzzy. You're not remembering it as clearly. Whereas with the app, we'll see, we're hopefully helping people connect these dots as they're happening. Uh, Hopefully build increase emotional awareness, increased clarity, and increased understanding of the consequences of if something happened, what were the consequences of that as well. And see these patterns unfold in real time. We also have a customizable toolkit that's in the app, and that can help people manage the stress. So we're not just tracking, it's not just a mood tracker, which you'll see a lot of those apps available. It's a mood tracker with an intervention that's connected into it. And we have integrated a warning screen so that if somebody's negative emotion or rumination is getting high, the app will actually trigger them and say, "Hey, it looks like you're having an emotional storm. Go to your clinical toolkit and use that to feel better." So this is it's got that signal-based component that's not present in most other mood trackers. So what are the Stormbreaker components? We've got an onboarding phase, an emotion, thought, and behavior tracking element, which we'll see in a minute. And then daily, weekly, and monthly progress, which is really nice because people can see if they're showing improvements over potentially months or even a year, the course of a year, for example. But they can also look and see, oh, wow, what was going on in my week and what was potentially things that were connected to that. We also have them rate interpersonal environmental factors associated with their emotional storms. The toolkit, which I mentioned, and then the warning system that I mentioned. And then also within the app, we have a connection to additional clinical resources, helpline access, further treatment. We have connections to a link to NEA BPD in the US, for example, so people can go and get information in addition to the other helpful aspects of the app. And then we also have customizable signaling elements where you can say, you can signal yourself up to 15 times per day. So if you were really into using this app, you could be doing these assessments and they would go off roughly 15 times a day and you'd be able to really track yourself and understand what's going on. We limited it that because we didn't want people spending, all day long focused on their phone only tracking. But so most people seem to elect to do, 3 to 6 assessments a day, and that seems to be a pretty good sweet spot. This is a good example of what some of these automated check-ins look like. How intense have your emotional storms been since your last check-in? And people can select the kind of emotions they're going to focus on. In this case, we have anxiety and annoyance. But you can actually archive those and switch to a different emotion. So you could focus on anger, or you could focus on uh, something like shame is a good example. But we have a long list of emotions. In addition, we have a thought tracking piece where people pick 2 types of thoughts they're going to work on, and these are meant to map on to the rumination experience that people are having. So it might be fears of future problems, dwelling on past failures, and several other options that people can choose. And again, they can tailor it, archive one, and switch to another, so it's customizable. Then we have the behaviors piece where people are trying to track if they've had any experiences with certain behaviors. And this includes some really high dangerous behaviors like self-injury, but it does also include things that are a little bit less dangerous, like binge eating, and then some things that are a little bit more everyday. So, for example, arguing or running away from a problem. And so somebody can kind of pick, what do I want to focus on improving with my behavior and tailor the app to meet those needs. This is what some of the screens will look like. These are just some test ones that we threw some data in real quick so that you can kind of see this. And so you'll see that, for example, you can track anxiety, annoyance, and thoughts. And if I could scroll up and down, I would, but I don't have the ability to do this. But this is kind of like on your phone where you're scrolling up and down, and you can see all this data right here at once and start to really get a sense of what your patterns are, including across days, weeks, and months. And you can start to see, if you look at the month one here in the green, this is fear of future problems. You'll see there was a few good days there where this was rated really low, but then you see some other days where this was a spike that might have been a little bit more trouble. We also have some pieces in it that will help people understand who are they interacting with. Is there someone that maybe causes them to have a little bit more emotion dysregulation? For example, maybe it's a coworker or a significant other or a parent. And then likewise, we have settings. Where is this occurring? At home, at school, or online? And that can help people understand what are the environmental factors are going into my emotional experiences and how that might be connected. And then we hope that they'll learn that when they're in those environments, that they can be more ready to implement skills that help them regulate emotions to help reduce the problem before it gets out of control. This is an example of our toolkit. We've gone through a couple iterations of this. Uh, Apple one because Apple doesn't let us do this because it's too much like marketing apps. So we have a little bit different versions of this, but this is what we originally designed where you could actually have the apps and scroll and pick them. Unfortunately, Apple wouldn't let us do that. But we still have some other good versions. They're just not as nice looking as this, which I like to show. Lastly, we include positive factors in the app because we don't want to just be about negative. We also want people to start thinking about like what are some positive things going on in your life? How does that counterbalance some of the experiences that you're having? And so trying to pick some things that are hopefully good in addition to the negative. This is a picture of what the app front screen looks like. There's a little video here, but you can, when you get the slides, you can watch the video and kind of see what it looks like going through the app. It's just a couple minute no audio video, but just kind of shows what it looks like. But I'm going to skip it for now because we're a little low on time. This here is a sampling of a study that we actually have that we just finished up a few months ago, and we're still in the data cleaning and publication phase. And these are from patients who actually used the app for a 1 month period. So they were people who identified as having high emotion dysregulation and potentially BPD symptoms. And then they use the app for a 1 month period and then track things like anxiety, arguing, fear of future problems, and sadness. And you can kind of see what some of the data is coming in that looks like here. And there's no identification. So, there's uh, no worries on that end. What you see here is sort of the general takeaway of the app in terms of the study and the pilot study that we've done, where we had 64 people in the study. They used the app for a month, and then we measured their borderline personality disorder symptoms at the start of the study and then at 1 month. As well as ECAM, which is our emotional cascade measure that we are using in this study. And then also just a general measure of depression, the CES depression measure. And we were able to find significant effects for these three factors, showing that using the app is improving some BPD symptoms, it's improving emotion dysregulation, and that's even helping with some things like depression. You can see this a little bit easier in the graphs, where we have the baseline on the left and then the app usage, the outcomes on the right. And we showed a 23% reduction in BPD symptoms. Not bad for a month. We didn't necessarily solve all problems, but for 1 month, that's not bad. And hopefully, in conjunction with things like treatment, that would be even better. And we also hope that this will be a bit of a gateway into treatment where people say, wow, this is helpful. Maybe I should go get more DBT or CBT potentially. We show a reduction in emotional cascades, and this might look like it's not that impressive. Oh, only 10%. But what I think is kind of interesting is based on complex dynamic systems, even like a 10% decrease in emotional cascades might have really resonating effects. Since we think that these are driving a lot of these problems and behavior, a smaller reduction in that might potentially manifest in some of these bigger changes that we're seeing downstream, such as overall BPD symptoms. And then we also found some reduction in depression as well. So these are some promising findings. Still a lot of work to do to look at the app and see its effectiveness, but this isn't a bad starting point to show that we can actually use a theoretically derived model, the emotional cascade model, apply that to technological interventions, and then actually show that we can actually help people out in the real world who might not have access to more traditional intensive treatments. Some of our next steps, we want to focus on trying to integrate some more artificial intelligence. This is such a new and rapidly evolving area. We haven't really been able to do a lot with that yet, but something on our trajectory, hopefully for next year, where ideally, as someone inputs their data, you might be able to train the AI algorithm to understand their individual responses and when their patterns are most connected to dysregulated behaviors, and then have the app tailor intervention recommendations as well as that targeted warning system that we talked about before. So I think AI would be a great addition into the app, but we'll see what we can do. It's rapidly changing. Some other factors that could be very interesting to use the app in conjunction with things like brain imaging studies to show if there's changes in neural facets of borderline as a function of this. Do we see improved emotion response in the amygdala, for example, which is connected to emotion dysregulation in BPD? And then a randomized controlled trial where we control the app to a control condition to show that it's not just tracking or doing some minor elements, but rather that the app is really effective in a core way. And then we also want to look at some clinical utility trials and making this a regular tool for BPD treatment for use in clinics as well, and working with your clinician and saying, hey, here's the app. How's this working with my clinician? Where were some patterns that we can hopefully make improvements? So as I wrap up, I did want to just highlight a book that my colleague Dr. Salvati and I published this year on theories of borderline personality disorder. This has a lot more detail, a full chapter on the emotional cascade model, if you're interested, but it also has other theoretical approaches to BPD, and it's a good survey if this is something that would be of interest to you. So I just thought I would mention that. Acknowledgements, the Emotion and Psychopathology Lab, including my graduate students listed here, have all been essential to accomplishing our work in this area. Again, the anonymous donor who provided the resources to be able to build the Stormbreaker app, and then the Families for Borderline Personality Disorder Research and the Brain and Behavior Research Foundation, which has supported our work in the past, and then Michigan Software Labs, who's been our collaborator with building the app. Here's my contact email, edward.selby@rutgers.edu, if you'd like to reach out with any questions or any ideas. And hopefully you've learned something interesting with this talk, and hopefully maybe even gotten a little bit better understanding of BPD and maybe your own or your loved ones' experiences. So with that, I will go ahead and stop sharing and take any questions that might have come up in the chat.
Right. So thank you so much for that. That's really exciting. I'm a clinical counsellor and I work with people individually with with using DBT, and I can just see how much that would accelerate treatment.
Thank you.
Because it like that trying to break down a storm retrospectively and addressing each element of it will take up the whole hour, and and that may be the case, but I can see where you can say, look, take this app, and now when you're feeling that way, they can get there and not have to remember back to what was said a week ago in session, which is
Absolutely.
really great. And I've got to say, reducing symptoms by 10% over 30 days is really fantastic. That's not standard. my experience of doing treatment is that it's a long-term thing, and it'll take a year or more, and then it gets really fast, but it's
Yeah,
really slow to
absolutely. Yeah,
begin. Yeah,
the big question is what those hold up over a long follow-up, right? And a lot of times they don't. So definitely still
yeah,
work to do, but it looks promising.
yeah. No, that's really fantastic. Um, so, what are the barriers for it becoming available outside of the US?
I don't think it'll be a huge amount of barriers. The challenge is mostly on the regulatory end. We have to activate things in the App Store. I don't even think that's actually the difficult. The bigger difficulty is, in our app, we have like emergency numbers for if you're having a suicide crisis, here's the suicide crisis hotline in America, right? So we would actually need to like sort of tailor that to each region, so at least it would make
Mm,
sense because we can't really expect people to be calling a different country to try and get that help. So those are, and the other problem is we don't really know what the barriers are because we haven't had a chance to get to it yet. So
mm.
we'll be very curious to see what we run into.
Yeah, for sure. Um, I'll see if there's a raised hand. Sorry, we're not letting people ask questions. Just pop the question in the chat. Um, uh, yeah, okay. Because I was going to say if it's money, put the word out now. But
Yeah,
certainly, I can see where perhaps we have an organisation in Australia called Lifeline, which is our suicide hotline, but it also does suicide prevention programs and things like that. And
yeah,
like to be
absolutely.
able to partner with someone like that, so that they can say, yes, these are all the resources that we already have that we can feed into it, would probably make a lot of sense.
Yeah,
Um,
absolutely.
yeah, okay. Um, so yeah, good to know there aren't too many uh, barriers in that way. I just want to stay focused on questions to do with the app to start with. Oh yeah, I was wondering what sort of, can you give some examples of the kind of skills that you have in the app that show how to use it? Like the distress tolerance skills, or are they based on DBT or other models, or how what does that look like?
Well, that's another area for future improvement. Like, ideally, we would have the app say, "Hey, try this meditation technique," or "Try opposite action from DBT," just as examples. For right now, unfortunately, all we have is a list that comes up for like, hey, it's go use your toolkit, and then we have a list. On the list, we have great things such as meditation apps, CBT-based apps, journaling apps, as well as links to like videos for DBT training that people can watch. So it's a good amount of options, but it would certainly be nice if we could build it up and have it even be more precise and specific. And that's where I think things like AI could really come in and really help enhance the app to like put those pieces in. We've talked about like, should we put like a paced breathing element into the app? And that could be a good example where we might be able to build on it further from what we have.
Yeah. Okay, that sounds great. It's very exciting, what you've had there. Um, where I mean, obviously, because our audience is carers and families, there are a lot of questions about how do we get people to go into treatment when they either don't see themselves as being, like just resistant to going into treatment, or perhaps rejecting the diagnosis of BPD. Um,
Yeah, that's a great question, and one that I get a lot. And it's sort of how do you get someone to do something they don't want to do is one of the big challenges of psychology and any sort of mental health helping field. And I wish I had the perfect answer for that, but what I do have is my perspective on this is that I think things like sort of like getting your toes wet interventions are a good start. So the Stormbreaker app doesn't, I don't, it does have borderline personality disorder, but it's more even like the clinical resources. It doesn't say, hey, you have borderline personality disorder, use this app. Instead, the app is framed as this app is meant to help you improve emotions and behaviors.
mhm,
So if you could get someone to like we are exploring ways to sort of deploy this in New Jersey with youth populations, like teenagers, and say, not getting stuck in like a diagnosis sort of discussion, but rather, hey, how's this going to help you improve your life? And then we think that as they use it, they would hopefully find it helpful, and then maybe even say, wow, I want more of this or more intense version of this with therapy, and then sort of get that foot in the door approach where you sort of get the idea that they need some help and some therapy. This kind of shows them that they can actually make some helpful changes, and then maybe even go to get a full dose of treatment.
Yeah, yeah. No, I can see how this the app is definitely going to be a fantastic foot in the door um, for people. And I would say, obviously, at NEA BPD, we offer family connections because often, you know, if you can treat a system, if you can get the family changing, then it models change, and it models getting help. And a lot of people report that the person that has the diagnosis or doesn't have the diagnosis but has the behaviour will get treatment after they see things can change. Um,
Yeah,
I have
and
to,
absolutely the one thing I kind of think of is, I mean, I think borderline personality disorder is a useful way for understanding this experience, but I kind of think of it, that's just the name that we give all these collective emotional and behavioral interactions. And so, again, I think if somebody was really sort of stuck on the diagnosis, I would go back to well, I'm less concerned about labeling this diagnosis as opposed to understanding that these are the stormy patterns that contribute to the trouble in your life. And so I guess that would be my 2 cents on if somebody was really struggling with the idea of having a diagnosis, and instead focusing on changing those patterns would, I think, be a good alternative to that discussion.
yeah, yeah. The question is, is this causing problems in your life? Would you like to
Yeah,
have these problems from your life removed? And
definitely.
sort of stepping into their steps. Um, I am looking at. Uh, I mean, is it something? Is the app something that people can try even without the diagnosis? Just to see how it works, and so that perhaps that they can. Um,
Yeah. Yeah, absolutely. That's actually as much as I wanted to market it in terms of being on the stores as like a BPD app, I just don't think there's enough general population knowledge of what BPD is or why you would want to potentially get an app for it. So we've actually taken the approach like all are welcome to use it. I think anyone would probably, if especially if you're not someone who's good at understanding your own emotions, using the app would be helpful in a lot of ways just to track your own emotions and your behaviors. One thing I forgot to mention is we actually have it so you can input your own target behaviors, emotions, and thoughts in the app. So let's just say you're like, oh, self-injury is not something I'm working on. You can actually like manually enter, this is the kind of behavior I want to track and monitor. So it's actually very amenable to be using by people from pretty much any self-improvement all the way across a lot of clinical disorders, but we're trying to keep a little bit focused, so I don't know to what degree it would help everything, but I think for a lot of self-tailoring, a lot of people could use it and benefit.
yeah, that's great. Yeah. Um, I think, sorry, the other questions that we have are around things that are sort of outside the scope of this webinar, like EMDR and other diagnoses, like when people have, PTSD and uh, they're a bit difficult, I think, for this particular um, one. Um, some people are saying that they've been able to download it. maybe
If you're
there's a
using
bend
a
around it.
VPN, it might work.
Yeah, yeah. I was wondering about that.
I think I saw
So yeah,
somebody putting the phone up, and I thought, did they get it? I wasn't sure.
yeah. So yeah, we've got in the chat, we've got people saying, yeah,
Excellent.
I've downloaded it, but I don't know if that's the exact app. So maybe have a look around. And yes, I was thinking about the VPN thing, and we've actually got some nice advice here around um how to get some help in Australia to get it out here with Philanthropy
Oh
Australia
yeah,
now. I've
great.
lost
I
that.
see it. Someone's
Yeah,
got
yeah,
there. Yeah.
yeah. For dollars to get an app in Australia, see Philanthropy Australia. use AI now and have USA help other US English speaking. Yeah. Anyway.
This is definitely something on our target for likely. We usually work with Michigan Software Labs in the summer. So this is going to be high on our list to get this rolled out, hopefully to other regions that are at least English speaking and maybe some Spanish speaking regions as well. And I will definitely let NEA BPD know when this is out, and it's
Yeah.
free for download. At some point we might try to ask somebody like down to pay down the road to keep it going, but at the moment it's completely free, and as long as we have the funds to keep it free, we will do so.
Yeah. And does it have an age limit on it?
I think that the App Store, if I recall, is like recommended age. I think we put 17 and older as the recommended, only because just to be safe, given there's some self-injury, that's an option that you can select, and we were a little bit concerned if that would be a problem for younger users. That being said, I believe, if somebody is 14 and I don't know if it stops them if they're like their account says they're 14, but if they lie on their account, it wouldn't stop them either. And we've talked with some high school groups as like if they would be concerned, and they the sort of high school perspective is kids are already talking about stuff like self-injury and they're aware of it. So the app wouldn't be doing any more beyond
Mm.
that, but still,
Mm.
it's a little bit touchy with youth. So we've tried to be a little conservative.
Yeah. And is that an area like for younger, I think, more for more children, because obviously BPD traits can emerge quite young.
Absolutely. Yeah.
Um,
We were definitely exploring like the idea of like if we can create like a Stormbreaker adolescent version that then
mm,
would have a little bit of tempered language and so on. So, but that's still like an exploratory area.
yeah, great. No, that sounds amazing. And I also want to say, I noted that you had how many positive experiences have I had today, which I think is really fantastic, so important, because so many mental health screening questionnaires I hate because they never ask, you know did you connect with someone today, when were you last feeling really happy, like there's no balance, it's all a focus on the negative, and especially if someone's tending to ruminate, they can get a little bit too negatively focused. So it's really great to see that you've put that positive
Yeah.
aspect into it as well. I think that's very strong.
Yeah, I'm a big believer in, we want to get problems and pain under control, but then we want to build life flourishing and positivity. So if I could add like a second section, I would add a whole ton of positive emotion stuff in there, but we're trying to get what we done at each stage, and who knows where it'll go in the future. So it might even have that kind of a much more in-depth positive emotion component in the future.
Yeah. Oh, that's great. I think that's pretty much the questions that are relevant to today's webinar that can be asked. Um, and yeah, look, I just wanted to say thank you so much. I'm very excited about this. We've got a lot of people saying thank you in the chat as well. And yeah, I really hope that the work that you're doing uh, gets disseminated much more widely in Australia. And now I'm going to try and download the app.
Excellent. Yeah, sorry, I was just looking at some of the comments in the chat there. Since I do think we're out of time, I would just welcome anybody who's got a lingering question. You're welcome to shoot me an email, and I will try to get a response back to you in the next day or two of any thoughts or questions that you have. So I would welcome you to reach out to me. Definitely see some very interesting and in-depth questions. I'm going to just drop my email address in the chat here, just in
Yeah.
case anybody didn't grab it earlier.
I mean,
And please
if you're comfortable answering, if you're comfortable, because we do get ones where people's stories are very long and involved, and in their, if you're comfortable answering sort of in general terms, we can run over if you can run over. But as far as, uh, yeah, I guess the the specifics of cases, I think for privacy reasons, we don't always ask all of those questions either.
Right. Well, I would say I think what would the best approach would be, rather than getting sort of into the weeds on some of these topics, is to definitely just pass your question along in my email, and that way I can give
Right.
you a little bit more in-depth response than sort of trying to give you 20 seconds, 30 seconds of a quick
Yeah,
snippet.
yeah, 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 yeah.
And I'm happy to try and answer these questions as best I can, and would love to get any feedback you have as well on the app.
Great. Okay, that's fantastic. Thank you again for your time, and we will certainly love to talk to you again when it comes out in Australia, and if possible.
I'll let you
All
know
right,
for sure.
great. Thank you. We'll stop
Thank you, everyone. Thanks
recording.
for having me.